Hello and welcome to HV Impact's webinar on maximizing father engagement to improve outcomes within MCV. We will be talking today for the next hour with several national experts and other folks representing their MCV programs for their states and territories. So we're really eager to have you with us today and get started. As you enter the room, if you could please introduce yourself in the chat box to the left of the slide deck. It'll give us a chance to know who's with us today. You can say your name, your position, or your role within your organization, and then what organization you're representing. I'm Karen Tyrone. I'm up in the left-hand corner. I'm the Universal Technical Assistance Manager for HV Impact, and again, very happy to have you with us today. If at any point during the session you have technical issues, there is a technical support box beneath the slide deck that you can tap in your questions, and we will have one of our support team get back to you. You'll also see a file share pod. This has the slide deck that we'll be presenting today, so at any point you can gather those slides and upload them and have them for yourself in a PDF form. Finally, we've asked you to call in to the audio today. The number is there that you can see. Some of you may prefer just to listen through your computer speakers, but if you're having any audio issues or any technical issues, please do reach out to our support team. All right, with that, we are going to start our webinar. So just a reminder, if you're having any kind of issues, you might want to mute your computer speakers if you're having an echo. You can use the technical support box. We will use the chat throughout the session to introduce ourselves and also to use for comments and questions. If you have a resource or something you want to share with fellow participants, please feel free to use that in the chat box as well. And I will remind you that we are recording this webinar, and this will be on HRSA's website, typically 2 to 3 weeks after the session ends. We will be able to put the 508 compliant transcripts and the recording of this webinar up on the site for you to view. So if you have colleagues who are not able to make it today, you can then share the link with them at that time. We really do value your feedback, so when you leave the session today, you'll have a reminder to fill in an evaluation. We would ask that you would take a few minutes to please give us feedback so we can continually improve our webinars for other MCV awardees. Our objectives for the session today, we have an action-packed hour. We will go through and review the Office of Planning, Research, and Evaluations research on father engagement in MCV programs. We'll then hear from the National Fatherhood Initiative on the importance of engaging fathers and how this impacts various aspects of the MCV program. And then we'll learn about MCV awardee successes. We'll talk to Texas and hear about some of their interesting practices. We'll talk to Maryland, and we also will be able to hear from American Samoa today. I want to point out that, unfortunately, we will not be able to have West Virginia present today. There was a last-minute emergency that prevented them from being on the call, but you will still see the slides that they were planning to share in the PDF slide deck in the file share pod. If you have any questions, please do follow up, and we'll make sure we connect you to ask questions of the West Virginia folks as well. Our presenters for today's call, we have Dr. Amanda Coleman. She is a Senior Social Science Research Analyst with the Office of Planning, Research, and Evaluation, also representing the Administration for Children and Families and the U.S. Department of Health and Human Services. We have Christopher Brown with us today. He is President of the National Fatherhood Initiative. We have Kaylee Benson, Research Director, Child and Family Research Partnerships from the University of Texas at Austin. We have Jarvis Patterson Askew. He is a Data and Fiscal Program Administrator, Office of Family and Community Health Services at the Maryland Department of Health Prevention and Health Promotion Administration. And finally, we have Kina Ioane. She is the Quality Improvement and Quality Assurance Representative for her program at American Samoa, MCV, Maternal, Infant, and Early Childhood MCV program. So thank you to our presenters for being here today. And at that, I'm going to turn it over first to our first presenter, Amanda Coleman.
Okay, thank you, Karen. So today I'd like to share some information about a project OPRE undertook in 2014 to learn more about approaches to father engagement and fathers' experiences in home visiting programs. The study was guided by two main goals. The first was to share lessons learned from the perspective of both program staff and fathers and mothers about how to effectively engage dads in home visiting programs. And the second goal was to provide insight and give a voice to fathers' own experiences, perceptions, and opinions about the home visiting programs they were participating in. So to conduct this study, we talked to a number of different stakeholders to identify 5 home visiting programs in the United States actively engaging fathers. And within each of these 5 programs, we conducted interviews with staff and parents to gain information from multiple perspectives. So we talked to program leaders about the program's history, philosophy, structure, the population and community served, how they train staff, and how decisions were made to involve fathers in home visiting activities. Our interviews with home visitors informed us of their own personal experiences working with fathers, including concerns and challenges, the strategies they used to recruit and engage fathers, as well as the type of supervision they received in training. We also conducted in-depth interviews with fathers to address a range of topics related to their home visiting experience, such as their motivation for participating, what a home visit was like for them, and what home visitors did to engage them. We also talked to them about what they liked and didn't like about the programs, what they felt like they gained from participating, and what recommendations they had for program improvement. The interviews also probed fathers on their individual circumstances, including their relationship with their children's mothers, their involvement with their children, and also their unique strengths and struggles with being a father. Lastly, we also interviewed a small number of mothers in each program to gain mothers' perspectives on fathers' involvement in the home visiting program. For example, we asked mothers how they see fathers' involvement in home visiting as being beneficial to them and their children, as well as mothers' views about the ways that home visiting staff can better attempt to engage fathers. So given the limited time today, I'm not going to get into kind of the coding and analysis approach that we used for this study, but if there's time, I'm happy to answer any questions you may have about that. I'm going to focus today on our findings around the strategies for engagement, as well as the benefits and challenges to engaging fathers in home visiting. On the OPRE website, we have a full report available from this study that also highlights themes around recruitment of fathers to home visiting programs and also information about fathers' first impressions of home visiting programs, but I can't cover all of that today. So to jump right into the findings, we found that programs used a number of strategies to engage fathers, and they mostly fall into 3 broad buckets, which you see here on the slide. The first bucket is around working to improve fathers' access to programs. So programs would typically have a broad overall program-wide approach of scheduling visits on days and times that work for fathers' work and school schedules. And programs would also emphasize planning visits for fathers separate from the visits for the mothers. So they would have father-specific home visits. The second set of strategies were around providing incentives and awards for participation. So programs would provide gift cards and baby products to fathers for participating. And the third goal was around tailoring services to fathers' preferences and needs. So at the program level, programs may hire male home visitors or use content during the visit that are specific to fathers and the ways that they interact with kids, such as by using like hands-on games and activities. In addition, some programs may supplement home visits with fatherhood support groups and family outings, which programs reported that dads seem to really like. At the staff level, there were several strategies that home visitors talked a lot about using to engage fathers. So one of the primary strategies staff emphasized was the importance of meeting fathers where they are. So being flexible in terms of logistics as well as the content. So kind of similar to the strategy we saw at the program level. home visitors were also doing some level of tailoring to what fathers needed. They also emphasized that it was important to not be judgmental about fathers' circumstances and to also be just a persistent and consistent presence in the family's lives. This also helped home visitors connect with parents as a trusted advocate. So home visitors emphasized that the program is here to help, not investigate, and I think some of this is illustrated by this quote on the slide. So a home visitor said, with this one particular dad, he didn't want me around. He didn't want people in his house. We get that sometimes. He grew up in the system and is scared of the system. I explained that it's good to have an advocate. I am on your side. Across participants, so both home visitors, fathers, mothers, program administrators, several key themes emerged regarding specific benefits of father engagement in home visiting. So the first two themes reflect the emotional and instrumental support that fathers reported receiving, specifically around connections to a peer community and instrumental support from home visitors. Several fathers discussed the value of having someone to turn to for help, and that help went beyond just teaching parents about parenting. This home visitor was sometimes serving even as like more of a mentor. The second set of themes reflected changes in fathers' knowledge and behavior, including increased knowledge of child development and improved parenting skills, better communication with partners, and anger management. And then there was a third set of themes around improvements in self-sufficiency, specifically linkages to employment, referrals to community services and resources, as well as material goods. Despite the benefits that were perceived by fathers, mothers, and staff, there were also challenges that they reported. Gatekeeping and staff resistance came up both in recruiting and engaging fathers in home visiting. Mothers and grandparents can sometimes oppose recruitment and can block access once fathers are recruited to a home visiting program. And this seems to be particularly true for programs who try to engage fathers through mother-focused visits. Similarly, home visitors who work with both mothers and fathers can put up resistance to engaging fathers in mother-focused visits for a variety of reasons. There may be safety concerns about the father's role. There may also be just concerns about being able to meet the mother's needs while the father is present, especially if the mother has multiple needs that require a lot of attention and the home visitor is limited in the amount of time they may have to spend with a family. The most common challenge was just logistics. Many fathers may work irregular schedules, making finding a time for home visits somewhat difficult. There were also challenges just around transportation, especially if a home visit is occurring somewhere outside of where the dad lives. So in conclusion, the study's findings suggest that there's a lot of promise in engaging fathers in home visits, and we really hope the program, the McVisa program and other home visiting programs can continue to do this important work. And we also hope that research is able to dig more into this understudied topic. Thank you.
Thank you so much, Dr. Coleman, for presenting today and sharing that great information. If anyone on the line has questions, we do have a couple minutes before our next presenter, so please feel free to type them into the chat. We have a question coming in right now from Karen McWhorter. How did you address concerns about domestic violence and emotional abuse? Did you address that, Dr. Coleman?
Sure, that's a great question. So a lot of our questions in the interviews were open-ended. And so home visitors did mention in their interviews that what happened kind of in this bucket with challenges, safety concerns, that's where most often they would bring up domestic violence or emotional abuse concerns. And so engaging the dad in home visits with the mother can be problematic. And so most of the home visiting programs and home visitors we talked to didn't necessarily have solutions, but in those situations, they honestly said that they would often just focus on the mother and her well-being. This was a small study, only 5 programs, so there may be other programs out there who have kind of better solutions for dealing with situations where they want to engage fathers, but domestic violence or safety concerns or a challenge. But most of the programs we talked to did not have kind of concrete solutions for that type of situation.
Okay, thank you. We're going to transition to our next presenter from the National Fatherhood Initiative. I will turn it over now to Christopher Brown.
Thank you, Karen, and thank you to everyone who's joined us today. We're certainly honored to have been invited to present today and honored to share the stage, so to speak, the virtual stage, with lots of fantastic work that's going on in different states around engaging dads in home visits. So in that regard, my role today is really to kind of set the stage for examples of the wonderful work that's going on around the country to engage dads by talking first broadly about what the research shows around the consequences to child well-being of father absence and also the benefits to child well-being of father involvement. And then to drill down a little bit further to talk specifically about the benefits of engaging dads for home visiting programs, specifically MCV programs, operating at both the state and territorial level. And then third, to share some lessons that we've learned with our work partnering with different state MCV programs to help them figure out what are the best ways for them to integrate the work that they're doing with local home visiting programs, the LIAs, so that they can approach this work from a very kind of integrated strategic and tactical perspective. So the data that I'm going to share with you on the first few slides, you can find all of that data, studies that we've pulled from for this presentation from our FatherFacts publication, which we just released the 8th edition of a few weeks ago. And so you see that source down at the bottom. So this is just a collection of some of the most widely researched outcomes related to the consequences of father absence. So children in father absent homes are more likely on average to live in poverty, perform poorly in school, develop emotional and behavioral problems, engage in early sexual activity, abuse drugs or alcohol, be neglected or abused, commit crimes, and also to commit suicide. On the bright side, what we know from research about the benefits to children when fathers are involved is that these children are, on average, more likely to have better cognitive outcomes, and we see this even as infants, higher self-esteem and less depression, including as teenagers, higher grades, test scores, and overall academic achievement, delayed engagement in sexual activity, lower levels of drug and alcohol misuse, and finally, higher levels of empathy and other pro-social behavior. So that's kind of the wide view of this issue. So specifically, when we start to look at how does engaging dads in home visiting programs benefit MCV, you can look at it from the perspective of what does the research tell us around the benefits of father involvement related to the 19 performance measures. And many of these measures are directly or indirectly impacted in a positive way when you engage dads. So for example, in terms of the preterm birth outcome measurement, we know that when dads are involved prenatally, that babies are more likely to be born full term and at a healthy weight. And when they are born preterm, when dads are involved with their infants, those babies are more likely to have improved weight gain. In terms of the breastfeeding performance measure, we know that dads who are involved and support breastfeeding results in moms who are more likely to breastfeed. In terms of the performance measure related to depression screening, we know that when dads are involved, moms are less likely to have postpartum depression and maternal stress as their child ages. In terms of the well-child visit performance measure, we know that when dads are involved, mothers are more likely to receive prenatal care. In terms of child injury, we know that when dads are involved in their children's lives, their children are less likely to suffer from injuries. In terms of child maltreatment, we know that when dads are involved, children are less likely to be neglected or abused. And in terms of the early language and literacy activities construct, we know that when dads are involved, particularly when they read to their children on a regular basis, their children have higher reading achievement. We also know that fathers can encourage children's literacy development in a number of ways, such as through reading to or with their children and discussing books with their children. Now, in terms of the work that we've done across the country, partnering with state-level McV programs, we've learned that what really helps these programs to do, first of all, is one of two steps, either in concert or one after the other, and these can be done in either order. First of all is to take a step back and do a comprehensive assessment of LIA's level of father engagement to kind of look at what is the foundation that we're starting with and what does that suggest about the direction that we need to go to help LIAs more effectively engage dads, and then also to enter into a strategic planning process where they bring in key decision makers at the state level and also local level with local representation to plan in concert with LIAs how they are going to address in a comprehensive way father engagement. The third step is that you turn the results of the first two steps into a strategic plan with action steps that are either centralized at the state level, meaning that all of the action steps are implemented by all of the LIAs, or to do it in a decentralized way where the LIAs can use the results of their own assessments to create their own customized approaches to more effective father engagement. And we've worked with state-level programs in both ways, centralized and decentralized approaches. And then finally, LIAs integrate father-specific resources. These are resources designed specifically for dads that allow them to maintain the fidelity of whatever evidence-based home visiting model the McV program in that state funds, and of course many states fund multiple models. So it's those four steps that we've found really are effective at integrating the work of state-level, territorial-level McV programs in those local programs that they fund.
Thank you so much. Yeah, thank you so much for presenting. If there are additional questions, please ask them in the chat, and we'll either address them now if we have a couple that come in. Otherwise, we have time saved at the end of the presentation if you have questions then. So thank you for that. And at this point, we are going to transition to our next presenter. We will turn it over to Dr. Kaylee Benson, and she's presenting on behalf of Texas McV.
Thank you, Karen. So we have been working with our partners at the state of Texas to evaluate the Texas home visiting, federally funded through McV, since 2012. And one of our first evaluation projects was to understand how home visiting programs were engaging fathers in the programs in response to a committed effort on the part of Texas to increase father involvement and engagement in home visiting. So we conducted focus groups across the state with fathers whose children were participating in home visiting programs, and we conducted surveys of mothers to understand how their children's fathers participate. Our biggest finding was that the most effective strategy to get dad involved happened to be the easiest. Invite dad. Specifically ask him to participate. Sometimes he might have been in another room. Home visitors left notes specifically for fathers. So sometimes they would, schedule home visits in the evenings or over the lunch hour so that dad could be there. So inviting dad, just actually asking fathers to participate was the most effective strategy to getting dad there. And then the most effective strategy to keeping dad involved was to help him understand his value to both his child and his family. And in the course of this evaluation, We identified other key strategies, including using inclusive or gender-neutral language, so referring to parents, mom and dad. These programs are not just programs for mothers, but they're for parents. Again, like I said just a second ago, when possible, home visitors would schedule visits or schedule the group meetings and the outside of home visit events at times when fathers were available. And this is an important one that actually resulted in a change, which was wonderful, was to address all documents to both parents and include space for both parents' names on all of the home visiting forms. And this was precisely why we had to resort to a survey of mothers about fathers, because none of the program models at the time, and like I said, this has changed, reliably collected dad's contact information. And so we had no way of reaching out to fathers to get them to complete a survey. We actually had to recruit fathers through mothers for the focus groups, and one dad brought the flyer that we had left with mom for the focus group, and that his child's mother had given him, and he asked us, why did I learn about this focus group through her and not from you? Why didn't you just ask me directly? And the simple answer was a logistic one, and it was we had no way of contacting you. And again, another helpful strategy that we learned that home visitors were doing was leaving materials behind for dad when he couldn't actually be at the visit, whether that was information that he might find particularly interesting or specific homework or activities that he could do with his child when he was available. We also learned, importantly, that fathers are engaging with home visiting programs in ways that we do not typically measure or observe. So as you can see, approximately 40% of mothers reported that their child's father at least sometimes participated in ways that were observable to the home visitor. So this included things like participating in the actual home visit, attending events or meetings, asking questions. In contrast, approximately 3/4 of, let me advance that. There we go. In contrast, approximately 3/4 of mothers reported their child's father engaged in ways unobservable to the home visitor. So this included practicing lessons or doing the homework at home in the evenings or on the weekends once dad was home, or even just asking mom questions about the visits that he couldn't attend. And oftentimes dads would ask questions and moms would ask the home visitor at the next visit and report back to dad. And so dads were engaging in the programs without actually attending visits, which really suggested that we need to rethink how we conceptualize father engagement. It's not necessarily just attending the visits or the events in person, but dads are participating and involved in home visiting programs in a much broader way. And then a couple years later, we extended that first evaluation on father engagement to look at the link between father participation and family retention in home visiting programs. And we found, even after controlling for important selection characteristics, that across program models, and in Texas at the time we have HIPPY and FP and Parents as Teachers, that families in which fathers attended at least one home visit were more likely to remain enrolled over time compared to families in which fathers never attended. Families with engaged fathers participated an average of 7 months longer compared to families in which dads never participated. So in sum, Texas is thinking strategically about how to engage fathers across programs, not just home visiting or our father-specific programs that we have in Texas, but any program that serves families and children more generally, and to make sure that we are receptive to engaging fathers in general. Thank you, Karen.
Yes, thank you, Dr. Benson. We did have a question that came in about what could I do to call the father's attention in and include him in an assessment if there are assessments being done. Can you share any strategies you might have around that, or maybe our other presenters have some ideas too?
Yeah, I would definitely open the floor to if any of the other presenters have ideas on that. So are we thinking kind of if dad is there in the house or in the home during the visit, but not actually participating in the visit, kind of how we would get Dad to participate in the visit if he's there, which I think is the question. Which I think, we did this evaluation, it's 2019 now, so 5-6 years ago, and at that time this idea of engaging fathers in home visiting programs was relatively new, and when we did surveys of mothers about father participation, we also did surveys of home visiting program staff about their efforts to engage fathers, and importantly some of their biases and kind of their perceptions about whether these programs were actually for fathers. And so at that point, this idea of home visiting, of home visitors actually just asking Dad to participate or encouraging Dad to participate or finding ways to loop Dad in was a really big step. And oftentimes it meant overcoming a lot of personal biases on the part of the home visiting staff. And that's not to say that that always worked, but I think it was an important strategy to just acknowledge the fact that oftentimes Dad would be there and the home visiting staff or mom would never really even think to include fathers. And so it was a really important first step. Now, once that first step has been taken, I think that if Dad is not particularly engaged at the beginning, I think persistence is key. We heard a lot. We heard from home visiting staff that, just kind of continuing to invite Dad and reminding Dad that he's important and that this is for him as well was helpful. Sometimes it didn't work on the first try or the second try, but, several visits in, Dad kind of started slowly coming in. Giving him tangible ways to interact with his kiddo is also a really important strategy for the programs that enroll and engage with families after the baby's born is also a helpful strategy that we heard.
Okay, thank you, Dr. Benson, for taking the time for that question. We do have another question that came in. What I'd like to do is move on to our next presenter, and we're going to put the additional question that came in into our presenter sort of queue. We'll come back to that question, but the question that's come up that I want to make sure we address near the end, it says, it's great that it worked for you, but how do you know that you're not overstepping boundaries when trying to get dads involved? And I think because this webinar in particular is designed for McV awardees, that it's a great question to think about how we can advise our LIAs, how they can advise then their home visitors not to overstep boundaries and some of the things that they might do to make sure that's a policy and a practice that they have within their own program. So we will think about that as presenters and come back to that question when we have some time at the end. With that, I'd like to turn the presentation at this time over to our next presenter. We have representing on behalf of Maryland McV, we have Jarvis Patterson SQ, who's going to share some of the efforts going on in Maryland. Jarvis?
All right. Thank you, Karen. And good afternoon, everyone. So here in Maryland, we know that, and across the country, we know that fathers have a boundless impact on the lives of their children. You can see here a picture of a father and his son, which also happens to be my nephew, and his father. And we can see how they have a source of joy between each other. You see their smiling faces and the body language is good, them playing together. We know coming from a strengths-based approach that when fathers are involved in their children's lives, that children go on to succeed and, attain the goals that they have in life. McV, we know, is a true two-generational approach type of a program. So it's not just about the child and the family or in our programs. It's also about the parents and making sure that we're addressing the needs that they have. If they have some apprehensions about being a father, if they have some apprehensions about how to, interact with their child, we're there in their lives to give them resources and give them the tools and the tactics to be positive influences in their children's lives. So it's important that we consistently communicate to our sites, our LIAs, that fathers have a place in McV, because sometimes it can get lost. And it also can feel as though fathers do not belong in the program simply because of, the acronym that we have, the Maternal Infant Early Childhood Home Visiting Program. But we know that not to be the case. We have several of our primary caregivers here in the state of Maryland that are fathers, and they are active in their children's lives. But, a funny story that, if I can have an anecdote, that we had a new program manager come on for one of our sites, and they were unaware that fathers could be primary caregivers for a number of months. And until, we had a conversation and we were kind of starting the fatherhood initiative, and, it wasn't apparent to him that fathers were, primary caregivers or could be primary caregivers because of some of the nature of the work. We know when you look at our curriculums, if it's HSA or if it's HIPPY or if it's, National Nurse-Family Partnership, that they can be heavily concentrated on, mother, baby, and the connection that they have. We can be heavily concentrated on things like breastfeeding and those sorts of things. But it's important that we connect these issues, much like Chris said, to father engagement, how fathers improve those results, improve those outcomes when they are active in their children's lives. So first steps first is always the state or leadership has to come and set a goal to prioritize a certain topic or subject matter. So in Maryland, we wanted to make sure that fathers were engaged, they were welcome in our programs, and that way we could give fathers the skills and the tactics and the tools that they needed to be positive influences in their children's lives. So we started with the National Fatherhood Initiative, so we can attest to the Fatherhood Readiness Assessment and how it is a good tool for sites to take, and also at the state level for administrators to take, because it highlights the areas of strengths that we have when engaging fathers and mothers, and also lets us know where we can build from a strengths-based approach, how we can highlight our weaknesses at the time and turn those into strengths. So through that process, we shared a number of tools, and we continue to share a number of tools through our newsletters and emails, if it's toolkits or whatever it may be. We have some on the preceding slides that you all can jot down and use with your own sites. But we wanted to be real intentional of including and engaging fathers. So if it's a home visit, when the home visitor comes, the father just doesn't go upstairs, because this is mother's time to be with the baby and to get skills and those sorts of things. But we want to be welcoming and say, hey, you can stay. You can get on the floor with us. You can play with the toys that we have, and you can do the assessments with us as well, and just being welcoming and positive with our fathers. So as a result of our Fatherhood Readiness Assessment, there were a number, 90-odd results that printed out for each site. And what we wanted them to do to convey the importance of fathers is that we told them to choose 3 results or outcomes that they had from the assessment in the areas of leadership, organizational development, program development, and community engagement, and really hone in and plan against or towards strengthening a particular weak area that they had. So this is the dashboard that we created and really aligned with our CQI process. So because we wanted the sites, program managers, CQI team members to look at this exercise and see CQI in it, and how evaluating ourselves and examining our processes in our organizations can really strengthen father engagement intentionally on an everyday basis, on a daily basis. So sites have been getting those back to us, and we've been sharing some of the results from the sites to kind of make sure that we're not siloed, and because we know challenges are shared across sites. So we want to make sure that exercises or ideas that have been thought of from our sites are shared amongst each other. So we have, or I have had the opportunity to kind of share some of these action plans that we developed, or the sites developed, with other sites in our state. So outside of the Fatherhood Readiness Assessment, we wanted to make sure that this exercise wasn't a one-off training. It wasn't something that we paid attention to for a short amount of time, and then we throw it in the recycling bin, or we throw it in the file cabinet, and it's something that we never address again. So in order to do that, we began asking our sites, what sorts of trainings or professional developments or exercises, activities, programs do you feel would be important for your sites, for your staff members, and for your families? So this could be like peer support groups for fathers. This could be, training around implicit biases that staff members might have because of their relationship with their fathers or the relationship with their fathers of their children and these sorts of things. So we really wanted to get into and increase buy-in from our sites by asking them, what direction should we go? What do you feel your weekend, or what do you feel your site is weekend? So that way, from the state collaborative level, we can really support everyone in the work that they do each and every day. And also, we wanted to communicate to our sites that when you have your staff meetings, that is a perfect time. You have everyone in the same room. You can ask them questions about, how they are engaging their fathers, what tools do you think that they need in engaging fathers, and also share some best practices. We all know that, some of the easiest way, or one of the easiest ways to get in contact with a man is to call his mother, or to have some sort of a contact with his family member. That is a good way to, as a gatekeeper, to get in there and let him know about the services that we're providing for his family. And also, again, to reiterate the strength-based approach, that when fathers are involved in their children's lives, their children go on to succeed, and they go on to be ready for kindergarten, they go on ready to learn, they're reading, they're talking, and they're engaging socially in an acceptable manner. So the networking opportunity scan, it just talks about just some of the resources that we've had available to us here at in the state of Maryland, and some programs that we participated in, some conferences that we participated in. Actually today, one of our sites shared with myself and the chief here of home visiting about a father and family seminar or workshop that's going on in California. And, again, to prevent that siloed effect, we want to include those types of resources in our newsletters, in our communications with our sites, so that way other sites can kind of get the tools that they need. And a lot of the workshops deal with things like child support and breaking down barriers there when it comes to engaging fathers, and they're not just being a revenue stream, or it talks about incarcerated fathers and their incorporation into their children's lives, and the number and the list of workshops that are out there goes on and on. But those are some of the top ones, along with as non-custodial parents, and how even though a father might not be the custodian of their child, they still have a place in that child's life. And there's a number of local fatherhood programs here in Maryland. We're beginning to connect with them in Baltimore City. We're beginning to connect with them in Prince George's County, and we're beginning to connect with them in other counties across the state to see how we can collaborate and build our systems and our system of care for our families when it comes to early childhood education and early childhood health and maternal health and the health of our families across the state. Thank you.
Okay, thank you so much, Mr. Patterson-Askew. That was excellent, and thanks for sharing those resources as well. If there are any questions, please make sure you go to the chat and put them in the chat. We'll have some time at the end for Q&A. At this time, I would like to turn over our next presentation to Tina Ioane with American Samoa McVie. And she is here today. Also along with her is one of her her male advocates, Fa'i, and he will also be joining in a little bit as well. So I'd like to turn it over to you, Tina, for the presentation.
Thank you, Karen. I'm hoping everyone can hear me. So father engagement in
We hear you.
Okay. Father engagement in American Samoa. We are the McAvee awardee, and we're also the LIA, the Ainga Manuia program. So we have a CQI theme since 2017. It takes a village to raise a child. So for this presentation, we have a father of the baby, mother of the baby. We talk about the home visitor's role, the supervisor's role, and the management team role of supporting on father engagement, and including messages taken out to the community. So for mothers and fathers, we have our way, their way. So mother baby's way, she has a desire when we recruit. She has a desire to share we share the information regarding the program to the father of the baby, and to engage with the home visiting services. In addition, mother also shares values with home visiting services with her partner, and there are activities that the home visitor shares about the information about child appropriate age milestones, and also linking with services and more. And also, mother the baby sees the difference between their older children and the index child that we serve in our program. And that's also a positive impact for the MECAV program, for our program. And it encourages the mother to, for the father or the partner to get involved with the partnership with their child, taking care of their child. So, father the babies. So, father the baby's way is when not interested at first, but often is curious and indirectly from listening to the home visiting services conducted by a home visitor. And also, he has good information from the mom. And then either he will directly ask his partner or wife regarding the home visiting services that we offer. And then sometimes the father joins in occasionally in discussion or questioning about the services that we offer. And then more often the father buys into our home visiting services is the basics. So what I'm trying to say is the home visitor takes a message to the mother, and the mother in her own way and desire shares with the home visitor, get involved, and also shares the message with the father of the baby. So the home visitor, the way of home visitor is more focuses on the mother of the baby during visits. So she's our primary caretaker and continually offers and invites the father of the baby at any time when he is available. And she is flexible if the father's available. And also stresses the importance of father's role in a family and with the child, and also engaging with the child and encouraging the mother and the father to get involved with raising their child. If father the baby needs intervention or needs some kind of help, the home visitor will also request support and will also link with the management and communicate with our management team, and then we'll develop an action plan to engage and help the father of the baby, especially the mother of the baby, if she's also asking for help. And this will also help enrich and encourage father to get involved with our home visiting services. So for our supervisors, so we have a male advocate over here with me, so they do a reflective supervision. So we have a Healthy Families America, that's our evidence-based model. So when they do a reflection supervision regarding family needs, there's understanding and engaging of father baby and MECAV program. And there's a strategic action plan for visiting a family to engage father baby. And then we have a male advocate, also a father advocate, that will get involved to come up with a strategic plan to take the message out to the father of the baby. And more importantly is understand and conveys the importance of father engagement in a cultural context. So we have a strong cultural essence over here in American Samoa. In addition to that, we also serve multi-generational. So it's not just two generations, but more than three at times that our home visitors had to work with and with our fathers in the family. So the management way is usually supports the supervisor and supports the home visitor and a family. And manager will also help schedule a visit and will help gather information so they could schedule strategically and be flexible around the father's availability. So that way father is available when they are there to visit a family with father involved. And with the management team or one of the management will go out. For this one example is for me and the program coordinator. We'll get involved in finding out what their family strengths the father and the mom. What are their family dynamics, their family strengths, and they want to bring out the best in the family, utilizing the reflective strategies that we have been trained on from the Healthy Families America. So after developing a plan, we participate in certain visits, and we go through the process of explaining confidentiality. We explain the importance of the home visiting services, and also just have them buy in what their family rights and responsibilities into the program. And our hope is have them trust our home visitors and our program and have faith that we are providing a great service to our fathers and mothers, especially for our fathers to engage fathers into the program. So for our messages that we take out to the community, there are regular reminders for this program that goes out to the families, especially for our mothers to pass down to our fathers, is the program is voluntary. They can quit anytime when they are no longer interested. And our home visitor will ask mother the baby during a home visit, uh, what will they gain from this program, and share that home visiting impacts the lives of fathers too, not just them, but also fathers. Having fathers involved is so important, and it's a parenting. Both parents are important to raise their child. Then we have a cultural aspect, and our home visiting and our program have a focus and is important on culture, because culture plays a big role in serving our clients, especially for fathers. They're traditional and they are head of the family, and majority of them makes a decision for the family. So our home visitors are sensitive to that, and they want to ensure the mom is comfortable with the service that we offered. And if they are also asked to wait on till they provide the answer later, they would. The home visitors will respect that as well. And that also goes well for the management when they are engaging with families with fathers involved. And also, we also reminder there are no materialistic things that we offer. The service is free, and we're there to impact lives of families and engaging fathers to enrich them and encourage them and empower them to get involved in their families. And then making sure the families, they can terminate services at any time. What also we have for our graduation 2016, we had 4, but the number has been climbing up. And 2018, we had about 25 families. This year, we had 35 families. And that's a milestone for our program. And then we have fathers that testify in our program during the graduation regarding about the MECAV and home visiting services that we offer. Okay. Our highlights for this year was our graduation. We graduated 35 index children, and it's our 4th anniversary for the program for those children age 3. More fathers participated, and we have fathers that testify and provide their testimony during our graduation. And our graduation was aired on KDCK, our network here in American Samoa. And the message was shared the importance of father, and this also provide a good message sharing how important father engagement in our island. And then we're here to share. We're so proud for our fathers that are in our program, and 2/3 of our fathers are involved in our home visiting services. And that concludes my presentation. If there are any questions, please.
Okay, thank you so much for sharing. We had a lot of good information come in today. We have 1 or 2 lingering questions I'm going to turn to our presenters right now. The first question came in From Natalie Perla, she asked a question. She said, this is great. I'm happy this all worked out, but how do you know you're not overstepping boundaries when trying to get dads involved? I'm going to turn this question to Kaylee and ask if she will address this.
Sure, Karen. It's a really, really important question, and definitely a very delicate balance. And I would say that I think that training and providing the guidance to staff and to your programs, that it just engaging dads also needs to be an ongoing dialogue with mothers, right? And so, I mean, obviously there are instances where engaging fathers is neither safe nor appropriate. So outside of those circumstances, if it's an issue of maternal gatekeeping, if it's an issue of mom not knowing how important fathers are for their kiddos, sometimes just helping mom understand the value that a relationship with the child's father can have for the child can be really helpful. And again, this is an ongoing dialogue. And so I think that whether it is a co-parenting issue if mom and dad are not together and not living together, working with mom about those things, again, within the context of it being a safe and an appropriate thing. And I think, again, that's information you have to ascertain, in the home with mom. But I think that, there sometimes is resistance from mom for getting dads involved, whether it's mom wanting this to be her thing or not knowing that, that it is very, very important for kiddos to have a relationship with their dad and is very beneficial for them. And so, again, I think that just helping staff and the LIAs understand that these are ongoing dialogues and conversations and not something that necessarily is going to happen overnight. And, I don't mean for our, simplistic invite dad strategy to over or understate how difficult that this can be. I think it was an important strategy kind of right out of the gate. But beyond that, and getting dads involved beyond that for whom that strategy did not work, just continues to be an ongoing discussion and dialogue with mom, and getting her input and investment in making that happen is important.
Thank you so much for addressing that, Dr. Benson. We do have 2 additional questions I'm going to pose to our presenters, but I'm also going to ask if we will open up our CQI polling. At the end of our sessions, we do ask you if you plan to take an action step based on this webinar, yes or no. If you do plan to take an action step, could you please briefly describe what that action step would be? And if you do not, what could we have done or helped you with that would have helped you further identify an action step? We also have 2 additional pods at the bottom if you'll take just a minute to answer one thing you learned today and one thing you still need after attending this webinar so that we can continue to help meet needs around this important area. While you're looking into these questions, I'm going to ask, there were 2 other questions that came into our chat. One was from Christina Serrano. She asked, how would we be able to access the Fatherhood Action Plan tool? And Christopher, I believe you're going to address that question.
Yes, thanks, Karen. Yes, so I believe you're referring to the Father Readiness Network assessment that we worked on with the state of Maryland that Jarvis mentioned. And the tool that is the basis for that is the free father-friendly checkup. And you can access it at our website. You can download it. It's fatherhood.org. That's fatherhood.org. And then I'd be happy to speak with you or anyone else on the call about how we work specifically with state and territory level McV programs to use that tool to assess the father readiness of their LIAs.
Okay, thank you so much. We had one additional question that came in. I'm going to have to ask Kate or April to read it aloud for me. I cannot see that pod at the moment. What was the question that came in from, I believe it was Tim asked a question? From my fatherhood classes, sorry, it keeps moving. Different cultures have different historical views of the roles of dad involvement. What are some suggestions to break that barrier? What an excellent question. Would any of our presenters like to tackle that in our last minute as we wrap up?
This is Kaylee. I'll answer another question.
Thank you.
Yeah, no problem. Tim, I totally hear you. This issue of kind of cultural and gender norms, and, you know, it's mom's role to raise the kiddos and dad's role to provide, if those types of things are very ingrained in some cultures. And so I certainly don't have the answer for you for how we change those large cultural and societal norms. But just to empathize with you, that it is definitely a struggle and it's definitely a challenge. And I think, you know, to some extent, just keep at it. I think, again, it's this idea of these things don't happen overnight, and it's ongoing dialogues and conversations with both mom and dad, that both of them have very, very important roles and impacts on their kiddos, but that those roles don't necessarily have to be as distinct as we often make them out to be, or that is so ingrained in some cultures. And so, you know, you certainly have to accept that and kind of meet people where they are, for sure. So I don't have any words of wisdom other than I know that we heard that all over the place in Texas from a cultural perspective. So I hear you, and I wish I had the answer.
I like that, meet people where they are. I think that's so important. So thank you. Thank you to all of our presenters today. I just wanted to share with you that all of the resources, these webinars, as well as other resources that have been published, are on HRSA's website at the link that you see here. We have another webinar coming up in December for HV Impact that will be on infant and early childhood mental health consultation in-home visiting. So I hope you will join us for that webinar. And then finally, we do have an evaluation that we value your feedback very much. Please take a few minutes to give us some additional feedback. Thanks again to everyone for joining us today, to our presenters, and I hope you have a wonderful rest of your day.